Back pain. It afflicts millions every year, and while it seems mysterious to many, it can usually be broken down into several easy-to-understand causes. In this three-part series on the low back, hip, and leg pain, we're going to simplify the causes of your pain. In 25 years as a chiropractor, I found that the average patient suffers from several of these, and because these are so common, we will briefly cover each one listed. The good news, most of you can have your pain greatly relieved, if not completely eliminated. In part 1 of this series, we will briefly review why posture and trigger points are almost always involved in back, hip, and leg pain. Next, we'll look at the 5 key muscles that can cause your pain. Most people find this section eye-opening. It explains why the cause of your pain can sometimes be baffling. We aren't surprised when someone complains of pain after a car accident or a fall, but you may be surprised to learn that many people suffer from back pain as a result of poor posture. When we have correct posture, the spine supports our weight with minimum work required from the muscles. On the other hand, when we have poor posture, the muscles become overloaded, and as a result, we frequently experience muscle, disc, and joint pain. As you look at this picture, it's easy to understand how this woman's muscles are working exceptionally hard. With poor posture, the head moves forward. When your head moves forward, your body starts to fall forward. To stop this from happening, the low back muscles must tighten. When they tighten, they spasm, and they create trigger points. We will soon discover just how important these can be in treating low back pain successfully. You may want to view the 2-part series on neck pain and headaches. We talk about the head forward position there. Poor posture can cause severe changes in the spine. It can dramatically change the way you look and how you feel. We're looking at the result of years of poor posture. You can do something about the pain associated with this condition. In fact, people are pleasantly surprised at just how good they can feel, even after years of pain. Whether your problem is from muscles, joints, or discs, there is help. Trigger points are one of the most common causes of low back, hip, and leg pain. To keep things simple, we will define trigger points as painful, hard areas and muscles. These trigger points are painful to the touch, and they can refer pain to distant areas. As you can see, they're found throughout the body, and they're usually found in predictable areas of the muscles. Trigger points make muscles shorter, and this creates 2 problems. Short muscles with trigger points pull harder on the joints than normal muscles. This stops the joint from moving smoothly, and this causes pain and stiffness. As a chiropractor, short muscles are important because correcting trigger points lengthens the muscle. This normalizes the tension on the joint, and this allows the chiropractic adjustment to hold longer. Trigger points cause 2 kinds of pain: local pain and referred pain. Pain caused by trigger points can be very frustrating for you, and the reason why is that trigger points can refer pain to areas far away. For example, the short hip muscle shown in this picture is only a few inches long. The X is the trigger point in this muscle. The red areas are where you feel the pain, but notice that the X is nowhere near where you actually feel the pain. Many people are amazed at the far-reaching effects of trigger points. This small muscle can cause pain all around the hip and all the way down the leg to the ankle. So much pain from one little muscle. If we treat only the areas shown in red, we won't be treating the cause of your pain, and you probably won't get better. We need to treat the X found in the muscle to get rid of your red areas of pain. It's just that simple. If you have pain in the back, hip, or leg, the chances are very high that you have a problem with at least one of these 5 muscles. The first 3 muscles commonly cause low back pain. The last 2 muscles commonly cause pain in the hip and the leg, and they can create a condition called sciatica, or leg pain. As we next look at these 5 muscles, I expect many of you will say, that's me. That's where I feel the pain. Let's see if that's true for you. You may be surprised. Our first muscle is the quadratus lumborum. Now that's a mouthful, so most of us just call it the QL muscle. This muscle is found in the back, and it is a frequent cause of pain in the back and the hip. As you can see, when the QL has trigger points, you may feel pain in the low back where the trigger point is located, or you may feel pain all around the hip, or both. Trigger points in this muscle can make you think you have a hip problem. After all, that's where you feel the pain. However, in this case, you must treat this tricky back muscle to stop your hip pain. As you can see in the picture on the left, the psoas muscle starts in the low back and it ends at the hip. When this muscle is involved, the pain is felt in the low back. One interesting thing about this muscle is that even though the pain is felt in the center of the low back, the best way to treat it is in the abdomen, where it is most accessible. It is a very tricky muscle, and it is a very common source of low back pain. The last of our low back muscles is the multifidus muscle. It is an exceedingly important muscle for two reasons. The first, of course, is that it causes low back pain close to the spine, as indicated by the red area. It's the second reason that makes this muscle uniquely special and a cause for concern. When the joints in the low back are involved, this muscle starts to waste away. This causes more pain and makes the joints unstable. In part 2 of the low back and hip series, we will spend a minute explaining this a bit more. For now, just realize that this muscle may be very small, but it plays a huge role in a healthy back. The next two muscles are found in the hip. The piriformis muscle is one of the most commonly involved muscles regarding hip and leg pain. Because it attaches to the hip, it can cause tremendous localized pain. As you can see from the picture, the muscle lies over the sciatic nerve. When it tightens, for whatever reason, it can press on the nerve and give you the exact same pain as someone who has a disc problem. In other words, this muscle can cause you to have leg pain all the way to the foot. If this most important muscle is causing your hip or leg pain, it must be treated for the pain to resolve. The last muscle we will look at is the minimus muscle. It is a small muscle and it often has trigger points. Because it attaches to the hip, it can cause an intense, deep, achy pain, often made worse when you lie on the affected side. And like the piriformis muscle, it can create pain down the leg, almost exactly like the pain you might feel if you had a disc problem. This is another very sneaky but very important muscle. If your leg pain is caused by the minimus muscle, it probably won't go away until this muscle is treated. Click on part 2 of this series and discover how scar tissue and muscle wasting can cause back and hip pain that never seems to go away.